So just over this weekend, Alberta Health Services confirmed a case of measles. It was confirmed by lab diagnosis in an individual who did have some activities in areas in and around the Edmonton environment. So because measles is a highly contagious, or it's an easily transmittable disease. Over the past couple of weeks, really are concerned mainly with May 9th through 17th. There's several locations in the Sherwood Park environment. A Shoppers Drug Mart location, and then two of our Alberta Health Services emergency facilities, our Strathcona Community Hospital, and then our University of Alberta Hospital here at the U of A. I can state about this particular individual is that they likely contracted measles traveled abroad or traveled outside of the North American environment and returned and then became ill shortly afterwards. So measles, again, is a very contagious disease. It's easily transmitted from person to person. It's transmitted through airborne means and can actually persist within physical environments. So that, for example, an individual sitting in a waiting room in a doctor's office or an emergency department, if they're coughing, they can actually spread illness, or can spread that virus throughout the physical environment, throughout that airspace. And if people are susceptible or people haven't been adequately protected against measles, they may actually contract the disease, unfortunately, quite efficiently. In some environments around the world, measles can be fatal. A lot of the time it causes a constellation of symptoms of fever, cough, and then very typical confluent rash that starts usually behind the ears, on the head, and spreads out throughout the rest of the body. In some environments, that may lead to a seizure, as well as unfortunately brain damage. But it is a serious disease. It's something that is vaccine preventable, and it's something that everywhere around the world has an immunization program to be able to protect against both measles, but many other diseases as well. Measles vaccine is a very safe immunization. It's very effective, greater than 99% effective after 2 doses. It's easily accessible, it's easily available, it's free, and it's the mainstay of preventive treatment and health prevention for everyone, whether they're a parent, whether they're a child, whether they're a patient, whether they're a healthcare worker. It's safe, very effective, and easily available.